Hi, my name is Emmy. I'm an occupational therapist from Lincoln, Nebraska. I recently passed my CHT exam, and I just wanted to offer some encouragement for other clinicians that are on the fence, whether or not it's worth it to do the studying and spend all that time, but also tell you a little bit about my pathway and hopefully be an encourager for other young moms and parents out there. I've been a therapist for about 10 years and only switched to hands about 3 years ago. I made the leap and it was scary. We get comfortable as clinicians in our little niche and it's hard to step outside of the boundaries. I did lymphedema therapy a lot the past few years, and linking that to hands has been really beneficial. I think the most challenging part is just finding time to study, no matter what your background is, if you have kids, if you don't, if you're involved in extracurriculars, making that time work for you. So don't feel like you have to study a certain amount of numbers every week. I found it really helpful to be in clinical practice full-time while I was studying, just because if there was a certain diagnosis that I wasn't sure about or I was having a hard time remembering, more times than not, within the month or two, we would have a patient come in that had that and just hone in on that experience from that patient and link it to my study materials. I think something to prepare for the CHT examination that can be overwhelming is just the amount of vast resources that there are. So pick one thing. Don't feel like you have to do a bunch of different courses or books or programs. Just find what's right for you. I just wanted to be here for encouragement for everyone, and just know that having your CHT just gives so much more confidence to your clinical practice. It helps your patients because sometimes they don't even realize what a CHT is or the difference, but then they'll say an awful lot about that, and that's always nice. But also for the referral sources, it's nice for those doctors to know that they have a therapist that they can trust because they've put in the time to study, they understand the diagnoses, and they're going to take good care of their patients. I just want to leave you with an encouraging thought. You just got to give yourself that self-esteem. Know that you can do it. We're not always going to know the right answers. There's not going to be a right time. I just would always tell myself, in the end, if I don't pass, what's going to happen? I'm going to study some more and take it again. So, there's not a bad option for pushing this. I think it's great for our profession, our patients, our referral sources, and I think it's a fun space to share. So I love networking with other people, mentorship, and I just wish you the best of luck.